Reading hard for you?
Yeah, reading can be hard.
Yeah. Okay.
It's hard for me.
Okay. Let's leave it there, and we'll see you again when we put the appliance in for you.
Yeah.
One of the clinical signs that this patient was overclosed or that his lower jaw was too close to his upper jaw came on the lateral skull x-ray, which you see here. When the teeth are closed, the lower lip is supposed to be vertical, and as you can see on this patient's x-ray, his lower lip is horizontal. You can see this vast curve underneath the lower lip here. This should not be here. Whenever you see a patient's soft tissue appearing thusly on an x-ray, you can know that the patient is overclosed. Another way of saying this is that his chin is too close to his nose, and this dimension needs to be increased, which is one of the functions of the appliance which he will wear. Another clinical indication is that his overbite, or the amount of vertical overlap of his upper teeth overlapping vertically the lower teeth, is too great. It's 60%, which you will see later on in a frontal view of his teeth. It should be no more than 20% at the maximum. These are both indicators that he is overclosed and needs to have the distance between his upper and lower jaws increased.
This young man's intraoral mouthpiece today. The question always arises, how thick do we make it, how tall do we make it, how high do we make it? And one way to do it is by putting in popsicle sticks or tongue blades and varying the height up and down to see what makes the ticks go away. Right. We have done this on him and have determined that a height of 3 tongue blades drastically stops his ticks. And so we are going to start with a height of 3 tongue blades initially for his mouthpiece. What we are going to do is mix up some acrylic, put it on this mouthpiece, and then have him close down on the soft acrylic till he reaches a height of 3 tongue blades. Open. You ready? Mm-hmm. I am loading the freshly mixed acrylic onto the mouthpiece, like so, and I'm going to put it in the patient's mouth. Open. Making sure the appliance is completely seated on his lower teeth. And then I'm going to have him close down, bite, until he closes down on the 3 tongue blades. Then open. I'm going to have him open. And I'm going to take out the appliance. And then I'm going to put it in the cooker while it hardens up. And I'm going to trim off all the excess acrylic. Okay, we have adjusted the patient's appliance, open, and we are delivering it right now. And fitting it to his bottom teeth. Right. Okay. Okay, now how's that feel? Yeah, hitting even. Yeah, okay. Good. Okay, look in the camera. Look in the camera. Okay. Now you're coming back this afternoon, right?
Correct.
Yeah. At what time?
I think like 1:45.
Oh, okay, good. That'll give him about 3 hours with it, then we'll do the final adjustment. You feel more relaxed or anything like that? Yeah, good. Okay.
You could notice a difference.
Say again?
You could notice a difference.
There you go.
Mouthpiece has really helped. Really helped with just it has really improved that I'm not as ticking as much. Like I would still have a few ticks once in a while, but over time it will get better. And during the 3 hours, I was like hardly ticking, and it really helped. It really helped. It really did. I'm talking fun with it, eating fine with it. It's not hard at all. It's really easy to eat and talk with it.
Ken has had the mouthpiece for 3 hours now. And he's just come back here before he leaves town and for a quick checkup, and he seems to be progressing quite well. Okay, this young man returns after 4 months because he lives so far away. He's been under the care of another TMJ specialist out in his local area, and we rebuilt his splint today. Take a look and bite. You can see how tall we made it here. It's about 6 or 7 millimeters high. Don't be afraid to make them this thick. We made it this thick to compensate for the long intervals at which we see him for the wear and tear. And he's doing quite well. You can see he's lost all that discoloration around his lips, and his head movements have diminished greatly. In fact, they've ceased as he sits here in the chair, and this boy is responding very well, as he should.
It actually helped me really well when I just came in here. I was taking a lot more, and then when this got built up, I just really relaxed a lot more.
Tell him why you're in Washington.
Part of the reason why I'm in Washington is because I got elected for a Tourette ambassador program. I got elected for that, so I'm going to have 2 days of training over at the state capitol, so that's going to be a really fun time.
Okay. And you're going to be meeting members of Congress, right?
Yeah.
Good. Well, we've got a budding politician here. Why don't we have his mother say something? Why don't you look at the camera? Okay.
Hi, I am Kenny's mom. I'm Carla Richards. I was elected Mrs. Washington last year, and my platform was embracing the special needs child. And part of that, of course, is advocating for my own son who has Tourette's, which is why I met Dr. Stack after doing research and found out an alternative treatment for Tourette's. So we came here last November, and before we met Dr. Stack, my son, one of his large motor tics was doing circles down the aisles of Target, for instance, or he would jump back like he had a string pulling on his back, so it'd take a long time to shop at the grocery store. But he no longer has those large motor tics, so that has been a huge blessing. The challenge, of course, is just being able to keep up with follow-up appointments, and not everybody on the West Coast knows of Dr. Stack's procedure, so we are trying to educate them as well. So it just so happens we're killing 2 birds with 1 stone. My son got elected to represent the state of Washington at the National Tourette Syndrome Association Youth Ambassador Leadership Program. And my son and I, we also started a support group together, so he reaches out to the children and I reach out to the parents. Although he reaches out to the parents too and gives them encouragement. And so we're hoping after this training we'd like to go back and visit schools and educate parents, teachers, and students on Tourette's, how to advocate and empathy skills, and of course how to implement programs as far as a teacher's perspective, and of course to educate people about this alternative treatment as well. So we are very encouraged, and we're just taking it one day at a time, but so far everything's looking good. So just seeing him right now, it's a relief that I see him having some relief from getting an upgrade to his the level of his retainer, so I'm excited about that.
This is Zachary. Zachary's a 22-year-old boy. who first experienced Tourette's at 7 years of age. He came to my office a day or two ago, and we took an MRI on him. We took x-rays on him today, and we've prepared a splint for him, and we're going to deliver it today. Tell the audience what you've been going through the past 8 years or so with your Tourette's. Tell them all the tics you have. You have head tics, face
Head tics,
tics.
facial, some verbal, like grunting, whole body jerks, shoulder. I mean, I probably tear a lot of muscles, pull muscles with my shoulder tics that I have. Always sore. I mean, I never complain about it, but I'm always sore 24/7. Hopefully they go away.
You sweat a lot.
Yeah, I mean, I drink maybe 3-4 gallons of water a day, and it comes right back out like it's nothing. So,
Okay, how do you do at school?
not very good.
Grade-wise?
B to D. I mean, college, it was a lot better. It was A to C, so I don't know.
How do you do with the girls?
All right. I mean, I got my girlfriend right over there.
What other than her? I mean, most girls get turned off by her. Most
Yeah, I'd say so.
You got one that understands you. Huh?
Yeah.
Okay, well that's good. That's better than most guys have.
Yeah.
Okay, and your mother found out about us on the internet, huh?
Yep.
Okay, good. Okay, just stare into the camera a lot, and show the audience some of your tics. And this goes on all the waking hours, 24/7, right?
Even when I try to sleep, I mean, I was up till about 2 in the morning last night and sweating really bad.
How long does it usually take you to get to sleep every day, every night?
I don't know. If I try going to bed early, I mean, I'll stay up late. I mean, my mom works third shift. I call her at 3-4 in the morning, and I gotta get up at 6:30 to go to work. So I mean, I might get 2.5 hours of sleep each night.
Oh.
And I mean, I can go a full 12-hour day at work without being tired. I mean, I'll get home, and I'm just physically as sore as can be. I mean, I feel like as in a weightlifting competition or something, extremely sore. Can't stop sweating ever.
Most people take 15 minutes to get to sleep. You take much longer than that.
Yeah.
Most of my Tourette's patients say they take 2 hours to fall asleep at least at night. That's a curse, in my opinion. You know, if you can't sleep soundly, that's one of the curses in life. Okay, let's see what we have here. Wait. Jump, jump. Tap down. Does one side feel higher than the other when you tap down?
Mm-hmm.
Okay. Which side feels higher?
Right.
Right side?
Yeah.
Okay. They feel that's that way, but see, it looks like you're hitting even heavier on the left side. You see how the marks are darker?
Yeah.
Right. That slows him right down, doesn't it?
It sure did. It's amazing.
Okay.
How's it feeling there,
All right.
Does it hurt you in any way, shape, or form?
No. It's just a little uncomfortable. I'll get used to it.
Yeah, you have to get used to it, like with contact lenses. That's the best thing I can relate it to. For about
Okay.
24 hours, 36 hours maybe, then you won't even notice it in your mouth.
All right.
And if he grinds his teeth a lot at night, you know, he may wear it down and symptoms may come back, and then you come here and I'll rebuild it back up again, and then symptoms may creep back and I'll rebuild it, and so on and so forth. That's how it works, but I won't have to do that as frequently, you know, that'll lengthen and lengthen and lengthen like that.
Okay.
I can talk better than I thought I would be able to with it in, but
Yeah, it's not going to be like the tongue blades you
Yeah.
had. Yeah. See?
and I won't drool all over myself either.
Right, and no one's going to see it. See, there's a
Yeah.
lot of advantages to this.
Yeah.
It's amazing.
Yeah, you think this isn't going to slow down your kissing of this young lovely here with like the
Oh, it won't.
the tongue blades.
It won't.
Yeah, okay. You want to try kissing them now? Just kidding. Okay.
That's all right.
Not while the camera's going, anyway. Okay. Each time you come, we're going to want to record you, just notice the improvement.
Okay.
Zach has seen a psychiatrist, a neurologist, two psychiatrists actually, and the one he at one point was taking 6 different medications. He weighs about 215 pounds now. At one point he weighed 320, and it was from the medications.
Wow.
And really it was no improvement. They just kept adding medications, hoping that it would help, but it never did. They tried Ritalin, all kinds of medications. All the antipsychotics that were real hard on him. He had some of the tardive dyskinesias even from the medications, where he'd have to take him into an emergency room and have the reversal drugs given to him, and it's been a long 13 years. So, this is amazing
Well,
that it can be drug free.
This patient returns after 4 weeks of receiving his appliance. He reports 2 very, very good weeks, 1 so-so week, and then the 4th week, which was very bad. His tics had returned because he had worn down his appliance due to constant grinding on his on the appliance. And open. Perhaps you can see and hear the indentations where it's all worn down. And what we're going to do is refresh this today and build it back up and reinsert it in his mouth and send him back on his way. And the rebuilding of the appliance is going to eliminate these tics and these uncontrollable movements. Okay. About 8 minutes have gone by since we took this out of the patient's mouth bite. We're putting it in, and I'm going to adjust it. Is one side higher than the other?
Yeah.
Okay, which side?
Left.
Left. Chop chop. Okay. You notice how the patient's symptoms have almost decreased completely, not quite, once we put the appliance back in. I'm just going to adjust it, fine tune it, open. You can see how he's hitting much harder on the left side than the right side, so I'm going to lower this left side here. Just tap up and down. Good. Right. That should feel pretty darn even. Right. Tap about 5 times. And that'll reset your nervous system. That's the entire adjustment, believe it or not. That's all that's needed. Does that feel better?
Yeah.
Calms you right down?
Yeah.
You owe me $100,000. Okay. That's a total of about 11 minutes for this appointment. It doesn't get any better than this. That's all that needs to be done on these patients. Now, if he doesn't wear it down, he'll be symptom-free for a longer period of time. If he wears it down, we just rebuild it, and his symptom-free intervals will get longer and longer and longer and longer and longer as time passes. Okay?
Yep.
This is a 22-year-old male patient whom I saw the previous day. He's a Tourette's patient with all kinds of facial tics and head movement disorders and vocalizations that he cannot control. This patient makes these facial grimaces and head movements constantly, 24/7. He finds them physically exhausting.
We're going to record you through treatment so that we can keep a record of the progress.
In addition, he sweats profusely.
Well, both. We need both of them to do it, so.
Do you get tired as this happens?
Yeah.
It wears you out, huh?
Wears me out a lot. I'm always tired.
What you see is tongue blades that he puts in his mouth. I have given these to him, and he varies them up and down, and as you notice, it stops his head movements and his vocal tics instantly.
Save it.
Are you going to take pictures? He gives you a breather, huh? So you can relax a little.
This is the third day since I have seen the patient. We initially took impressions of his jaws, and we have had a lower mouthpiece made over the last 2 days to fit to his mouth today.
Have you been using that temporary thing since you left yesterday? And you can tell you're more relaxed, right?
Yeah, I'm starting to sweat again.
Yeah.
I'll start sweating.
It is a workout.
Yeah, it is.
When I kept it in, it kept smashing down. I can feel a little bit more.
Some of the height, yeah. You were
Well,
losing some of the height.
yeah, it was something else smashed down real quick. But,
I made him an appliance,
but it's not as
and
bad as when
I am in the laboratory adjusting it. You can hear the grinding noise in the background, and that is me working on his appliance. He is being interviewed by my dental assistant.
And the amazing thing is you get to rest,
Yeah,
you know, because it really is a
luckily-
workout. Yeah,
I'm not sweating.
yeah.
It's like you turn on the switch. When it comes out, he starts sweating because he's fighting so hard to try to keep it in.
The previous day, I gave him a bunch of tongue blades and varied the height of them up and down to alter his vertical dimension or the space between his upper and lower jaws. And I dismissed him with a handful of tongue blades, and he has taped them together and holds them in his mouth.
Spread your lips just a little bit like that.
He had the medicine. He tried the medicine.
Hold on, let me zoom in.
Got out of there. It was about 6 years of loss of memory. And it didn't have much.
Yeah, you can.
Now we're putting in a splint here.
The patient is closing down on soft acrylic that the assistant has mixed up and applied to the splint. He will close down until he reaches 11 millimeters on the ruler, which is the height of the tongue blades I previously measured that the patient arrived at by wearing them and adjusting them up and down the previous day and evening. This is the height at which he arrived at which his symptoms were totally gone. So this is going to be our starting point at which I will construct the splint, and from this point I will vary it up and down at future appointments. I have allowed the acrylic to harden up and I have trimmed the occlusal surface down so it is flat. This is going to be essentially what is called a pivot appliance. It is going to have one-point contact on either side with a lingual cusp of the maxillary first molars occluding with a flat table of the lower appliance. We are going to rebalance the lower appliance so that he occludes simultaneously in time on each side and with simultaneous pressure on each side. Notice how his vocal tics stop instantaneously.
And that's all there is for for today's appointment. It's that simple.
It was last seen 12 days ago, and he's back today for an adjustment.
Within 12 days, my life has extremely changed. I've had a couple of job interviews. I've been able to sleep a lot better. All of my tics are pretty much gone. I still have a little noises here and there, but it's not compared to what I had 12 days ago. I just feel totally different about myself. I've had more energy, able to get out in public. I'm able to walk into places and not feel that people are staring at me. It's pretty much a confidence booster for me. It's made me change a lot. Friends and family they can't believe it. So it's definitely done some help to me.
Okay, in 12 days, this patient has worn the appliance down a little bit, and we're just going to resurface it a millimeter or so, maybe even less. And these noises that you hear and any slippage back to his original condition will be totally eliminated. 100% gone?
A little bit, there's still a little bit more, like I say, I think it's because of the nerve is forming back.
Okay, this is the end of the second appointment, 12 days after the first appointment. As you can see, all the vocal tics are gone. Everything is quieting down. And we're going to send this young man back to his mother and his girlfriends in this condition.
This is the patient as he returned 12 days after the insertion of his lower appliance. Notice the absence of his presenting symptoms, the facial tics, the vocal tics, the head movements, etc.
Tell me what the difference has been in those 12 days.
Well, I've had a lot more energy. I'm able to get out places and just be able to enjoy the atmosphere and not have to worry about people, looking at me. And I've been able to go to sit-down restaurants, and it's been amazing treatment for me. It's helped me 100%, and I'm very blessed to have been able to get y'all to build this appliance for me.
Good. Now your symptoms were mainly
the vocals. It was mainly loud vocals, and with a little bit of head jerking and body jerks. It's completely went away. I'm more rested, not having the body jerks, more energy. Don't know what to do in a day's time, so everything's just gone.
Go. And last time Dad was here with you, and did you drive up or did
he did?
He did.
But after I got the appliance, I was able to drive and be able to actually relax and not get stressed out to make my Tourette's worse. I think I was about 5 hours of sleep that we had that night when we were there, and usually stressful situations it would get worse. But with running through all the traffic, it was around 6 o'clock when we actually got to the highway. It was an 8-hour trip, so I drove the whole way, and there was no signs of it. There was a lot of traffic that night, and I was just calm as could be.
Good. Now you were telling me something that I never thought about, and that was about reading.
I was the night I got the appliance in, I was actually able to read for about an hour, where I could actually understand what I was reading and not have to start back over numerous of times and just eventually